Yesterday, DPH reported test results for over 15,500 individuals. That brings the total number of tests that have been administered in the Commonwealth to almost 1.5 million. There were 356 new positive cases reported yesterday. That number appeared higher on Wednesday because there was a delay in reporting to DPH from a big hospital group. DPH has assigned those positive test results to the appropriate day of the test retrospectively. In total, there have been 109,096 cases statewide, and the 7-day positive test rate is about 2%. 368 patients are hospitalized for COVID-19, and of that, 62 are in the ICUs. The 3-day average number of patients hospitalized is down by 90% since the middle of April. Currently, only 2 hospitals are using surge capacity, and that's not for COVID. As I said on Monday, we've seen good progress here in Massachusetts. Our goal, of course, is to continue to drive down those numbers, but that's only possible with the vigilance and the discipline of every resident. Recently, there have been reports of community outbreaks, in many cases that were linked to parties or a location that wasn't complying with the COVID-19 guidance that's been issued by the Commonwealth and by the feds. In many cases, people haven't been wearing face coverings or socially distancing. And the positive increase, we've seen a slight increase in our positive test rate as we've continued to expand our testing capacity. The reality of COVID-19 is it does not follow any rules. It can spread rapidly if people don't take the appropriate precautions. It's not taking the summer off, and we can't either if we want to continue to fight and contain the virus and keep our economy going. People in Massachusetts have worked exceptionally hard over the course of the past several months to get to this point. Our frontline healthcare workers, our small businesses, our individuals, our moms and dads, our brothers and sisters, our neighbors, to beat back this insidious and at times invisible virus and to get back to some degree of normalcy. To all our residents, I can't express this enough. Don't be careless or complacent. Wear a face covering, socially distance, and practice the good hygiene that has had such a big part to play in our success so far. Use common sense when it comes to visiting with family and friends under all circumstances. Observe the sector guidance that's been issued by the Commonwealth to ensure that your activities and your businesses are operating under the appropriate precautions. Until we have a treatment or a vaccine, I know you're working on that one, we have to learn how to continue to live with this virus. I can't stress this enough. We must do our part as individuals, as families, and as communities to prevent the spread of COVID-19. We'll obviously continue to analyze and produce data to see if there are adjustments that we can make, and we'll continue to trace and isolate every possible case. But these efforts alone won't keep the virus in check. People need to do their jobs with face coverings, distance, hand washing, and everyone thinking twice about what they're doing and how they're socializing with their friends, their family, and their neighbors.